Some research suggests that 1 in 4 youth in this country experiences some sort of mental health disorder a year. According to the World Health Organization, that's 1 in 6 people aged 10 to 19 years old. One thing you can do as a parent is have a conversation with them to get them the help they need. Dr. Caroline Leaf is a leading neuroscientist who, since the early 1980s, has researched the mind-brain connection. She's also the author of the new book, How to Help Your Child Clean Up Their Mental Mess. And I'm excited to welcome her back to Morning in America. Thank you so much for being here.
Oh, it's so great to be back with you. Thank you.
Yeah, good to see you again. Yes. So in terms of children, I was watching some of your TikTok videos and Instagram videos. You have said that they are more perceptive than adults in determining what's going wrong or if something is bothering them mentally. How so?
They have tremendous insight into what's going on around them, but they don't always have the words to be able to explain that. So they're very good. They read authenticity, they read body language really well. And if we don't help them manage that, those underdeveloped mind management skills can lead to them feeling those intense feelings of overwhelm and confusion when they're exposed to things that they don't understand and they don't know how to process those. They don't know what's happening. If they don't have those mental skills, their insight combined with not having the mental skills can lead to tremendous sense of vulnerability and mental health issues.
And that is so important to watch out for. But you also say there are warning signs. So if you're a caregiver or a parent, what should you watch out for?
Very important to watch out for four major types of signals and how they show up. And the first one is the emotions. So what kind of emotions are happening? Depression, anxiety, frustration, and specifically what changes, what new patterns. The second signal is to look at the behaviors that are associated with those signals. So what are they saying? What are they doing? How are they saying it? How are they doing? And how does that link into that emotion? The next thing is to look at their bodily sensations or bodily signals. Are they suddenly complaining of headaches? Are they complaining of sore stomachs? Do they seem to be in pain in some way? Are they developing a tic or whatever, that kind of thing? Then the fourth signal is to look at their perspective. How are they looking at life in the moment? Do they suddenly not want to go to school when they always loved going to school? Do they suddenly not want to go and play with a friend or go to the park when they always wanted to? So the key thing, Adrienne, is to look at those four categories and describe in as much detail as possible through observation, and then help them. That's how they're showing up, and specifically look for the pattern of those. And if there's a change in the pattern, that tells you that something is going on.
When they imitate an adult in their life they look up to, whether it is a parent or a caregiver, that's something that you could actually see as a little mirror if you're going through your own mental health challenge. So what's good advice for moms and dads?
Well, the stress, the unmanaged stress of the moms and dads and caregivers, parents, teachers, that becomes the unmanaged stress of the child. So one of the key issues in helping in the mental health crisis currently is for us parents to be authentic and model how we are managing our mental health and walk through those steps, our signals and so on with children, because then that models for them, hey, it's okay to be a mess. Life is hard. We get messy, but there's a way of getting through the mess. So our vulnerability is so important.
Our vulnerability can be our strength, Dr. Caroline Leaf.
Absolutely.
I am so grateful you came on. I think a lot of parents are certainly wondering, what do I do? Again, your book is out right now, and they can buy it wherever books are sold. Thank you so much for being here. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.